in high definition. Live, local, late-breaking, KHNL News 8 at 5.
Welcome back. It has been 1 week since we featured liposuction so advanced you can get it done over your lunch break and then go to work the very next day. Mariela David joined a patient who is among the first in Hawaii to try it. She's live now to show us her results. Mariela?
It's clear from her before and after the procedure works, but is it really that much faster and less painful than traditional liposuction? We caught up with Calais Fernandez to find out. Just a warning, some of the video we're about to show you may be tough to stomach. Going under the laser instead of the traditional knife, Calais Fernandez tries SlimLipo on her stomach and inner thighs. 1 week later,
hi, nice to see you again.
Calais is back at the Queen's Medical Center for a checkup with plastic surgeon Dr. Ching, the first to offer SlimLipo in Hawaii.
Not really that swollen, just a little tender, but other than that, it's a lot less pain than I thought I was going to be in.
Calais says the next day she was only on Tylenol, nothing stronger. SlimLipo is less traumatic than traditional liposuction. Instead of breaking and suctioning out fat that's still intact, the laser melts the fat before it's removed. Needing only local anesthesia, Calais was awake during surgery and walked right out after she was done.
I felt really good. I don't know if it was the pain meds, but I just went right home and I went to sleep and I felt fine.
Calais is still a little sore.
It's just like if you banged into a wall or something or hit your knee or stubbed your toe. It's kind of like that kind of pain. It's not really anything big.
Calais didn't end up going to work the next day as planned, saying she was too tired from the lingering effects of the anesthesia.
I took the day off just because I didn't want to just go rushing right into it, but I could have gone.
This high-tech procedure costs about $3,500 for one area. Since Calais had 2 areas done, she paid about $6 grand. But SlimLipo isn't for everyone. Dr. Ching says it's for smaller amounts of fat. For people with larger amounts, he recommends traditional liposuction.
It's not a way of losing weight. It's really just a way of reshaping the body into a more pleasant shape.
A shape Calais is happy with.
Bye. Thank you.
As she leaves here, ready to go on a cruise in a couple weeks.
Yeah, I'm excited. I'm going to go buy bathing suits in Italy.
And you can see Calais' before and her 1 week after photo on our website, KHNL.com. But actual results take about a month. That's about how long it takes for the swelling to completely disappear. Reporting live, Mariela David, KHNL and K5 News.
Considering liposuction, why not have it done on your lunch break? You can with a new procedure now available for the first time in Hawaii. Mariela David has more on what's called SlimLipo. And just a warning, some of the video you're about to see might be a little graphic.
Calais Fernandez is one of the first in Hawaii to try it.
So we're going to have you fill out a few forms.
Laser liposuction, called the Slim procedure or SlimLipo. Her target, stomach and inner thighs.
I've been, diet and exercise all the time, but there's just some spots that just have not gone away.
Women and men tend to store fat in certain areas, and those areas of fat are typically exercise resistant.
Dr. Ching is a board-certified plastic surgeon at the Queen's Medical Center. He's the first to offer SlimLipo in the state.
At first I was skeptical because as doctors, we see a lot of technology that often doesn't really pan out.
But after a month using this machine, Dr. Ching says the results have been positive. These are before and after photos of some of his patients.
I've seen people with very limited swelling, very limited bruising, much less pain.
In Calais' case, after about 30 minutes under the laser without general anesthesia. How are you doing?
Good.
How are you feeling so far?
Good. Relaxed.
You don't feel any pain at all?
No.
The reason? The laser melts and liquefies the fat before it's removed. Traditional liposuction breaks and suctions out the fat that's still intact. Plus, the incisions are smaller. For Calais' stomach, one cut through the belly button. That means fewer scars, less post-surgery pain, and shorter healing time. So short, Calais says she plans on going to work the next day. Mariella David, KHNL and K5 News.
Next Tuesday, we will check back in with Calais to show you how she's doing, see if there's any changes.